Hi, welcome back to Kentucky Health Solutions YouTube channel. My name is Justin Olds. I'm a licensed agent here in Kentucky, and we're going to go over a Medicare 101 educational presentation for you. We title it Getting to Know Medicare. So again, we're Kentucky Health Solutions. Feel free to like and subscribe to the channel while you're here. We really do appreciate it, and it'll keep you up to date on any new videos that we release for this Medicare 101 series, as well as any updates or other videos and content as we come out with it. Let's hop right into this. So a little bit more about us in case you missed our intro video. We started in 2010 here in Lexington, Kentucky. We're licensed in 10 states. We have 4 licensed agents and growing. Our primary focus is Medicare, but we also serve those not on Medicare, so you're under 65 and Affordable Care Act plans here in Kentucky at least. Our core philosophy is education and consultation. We don't want to just sell you and leave you out to dry. We want to be able to service your policy, create kind of a relationship between us. So we try to build that trust with our clients. So moving on, just feel free to keep that in mind and contact us if you have any questions or needs. If you're outside of Kentucky and you may be one of our other licensed states, we'll do our best to help you there. Outside of that, we can always look at expanding into other states if needed. So feel free to visit our website, fill out a contact form, or give us a call. So getting into the Medicare. Who's eligible for it? So it's U.S. citizens and legal residents. So as it says there on the slide, legal residents must live within the U.S. for at least 5 years in a row, including the 5 years before applying for Medicare. You must also meet one of the following requirements, which is be 65 or older, younger than age 65 with a qualifying disability, or any age with a diagnosis of end-stage renal disease or ALS. So a couple qualifications there. You can see the red, white, and blue card and what it would look like potentially for you as you go to enroll. There are a few different parts of Medicare coverage. So the basics are Medicare Part A and B. That's what we call original Medicare. So that's your hospital and medical coverage provided through Medicare. And you do have a monthly premium for that, which we'll get into here in a little bit. And then you have secondary options offered by private insurance companies. So those are going to be your Part C or Medicare Advantage plans that I'm sure many of you have seen advertised on TV. Part D prescription drug plans, which is just for drug coverage. And then Medicare supplement plans, which are your lettered plans, which we'll get in again a little bit more later on. But these plans are going to supplement your original Medicare. They don't kind of replace it. So Part A hospital insurance, what does it cover? So it's going to be your hospital room and meals, skilled nursing services, care in special units such as the ICU, blood transfusions, drug and medical supplies while at an inpatient stay in a hospital, hospice care, part-time or skilled care for the homebound after a qualified inpatient stay, rehabilitation services after a qualified inpatient stay, lab tests, x-rays, again, as you are inpatient, and then operating room and recovery room services. So basically anything having to do with you staying in the hospital, Part A is going to pick up that cost. Now there's some cost to you associated with that, which is why you look at those secondary options. Part B medical insurance. So Part B is going to be your outpatient care. So that's your doctor's visits, including when you're in the hospital. So like if you're at a hospital and you're doing like an outpatient surgery, that's going to be included. Your annual wellness visits, your lab services, x-rays, MRIs, CTs, mental health care, durable medical equipment, all the things you see listed here on the screen are going to be covered under that Part B outpatient services. And so there's usually a deductible and some other costs for that. So let's get into some of these other things that are not covered, and then we'll jump into those costs. So original Medicare Parts A and B does not cover most of your dental care, eye exams for routine care. If it's for the diseases of the eye, that is covered under Part B. Any cosmetic surgeries, massage therapy, hearing aids, long-term care, concierge care, also called concierge medicine. That's usually a cash cost. So those are things that Medicare doesn't always cover. Now, those secondary plans can sometimes pick some of this stuff up. So getting back into the costs, like we were talking about, Part A. So for most people, it's a $0 premium on your Part A for original Medicare, as long as you've worked 10 years and paid your taxes, or if you have a spouse that has worked at least 10 years to pay their taxes. So it's usually 40 quarters is how they put it, but 10 years is 40 quarters. So for Part A, if you were to go into the hospital, you would have a $1,556 deductible for this year, 2022. After the first 60 days that $1,556 covers, you would have $389 per day for days 61 through 90, and then you have a lifetime reserve days of 60 at $778 per day. And there's no out-of-pocket limit on this stuff. So outside of, if you stay in the hospital multiple times, you could face that deductible multiple times within a year. Your Part B outpatient cost. So this is the one that usually has the premium, which for most people in 2022, it's $170.10. There will be a chart a little bit later in this presentation that's going to show what it could be if you had a higher income, so bear with me on that one. Deductible for Medicare Part B this year is $233. So if you were to go into the doctor's office, if it's not your standard annual wellness visit under your preventative care services, if it's just a regular checkup or a specialist visit, you're going to be paying towards that $233 first. Then, once you've met that, you're usually paying 20% of the approved amount for covered services and any maybe excess charges if there are some. And again, no out-of-pocket limit. So that's why those secondary options are very important, because you can pay until you don't have any money left on these, or with your secondary options, there's a cap on your cost. So this is that chart that I was telling you about for the Part B cost and how your income may reflect that differently. So for 2022, they actually look at your 2020 taxes. They look 2 years ago, and they'll look at those taxes if you're filing jointly or individual. Take a look at this chart here. Feel free to pause the video if you need a second to find it. And it's going to tell you what your Part B premium plus the income-related adjustment is. And so, for instance, at that $182,000 or less for joint filing couples, $170.10 is the Medicare premium you would expect per person if you're both going there. If you step up to that next bracket, the $182 and $1 up to $228, you're looking at $238.10 per person. Again, that's assuming a couple filing jointly and enrolling at the same time. Your Part D drug plan also has that income-related adjustment, so keep an eye on that. Your drug plan will increase as well. So feel free, like I said, pause the video, take a look, see where you would fit if you're looking and getting ready for Medicare. Now, question that we get asked sometimes is, should we sign up for Part B? Because there are certain times where it's kind of optional. So you have to have Part B if you're wanting to join a Medigap or Medicare supplement policy, if you want to join a Medicare Advantage plan, if you're eligible for TRICARE, or sometimes your employer coverage requires you to have it. So if you're working past the age of 65, you're not usually required to sign up for Part B, but some employer coverage does require you to do so. Now, with veterans benefits, it's usually optional, but you do have a penalty if you sign up late or don't sign up during the initial enrollment period if you wanted to use it later. Because I know veterans, you can usually use the VA or the VA hospital for most of your care. And if you're fine with that, that's awesome. But there are specific plans designed to help veterans as well, where Part B is not optional. So just keep that in mind. And a little note down there that's a little cut off, I've already spoke on. It's basically if you're currently working past the age of 65, your employer group plan does waive the penalty for Medicare as long as it's qualifying. If it's not qualifying, you may still have to enroll in Part B. So keep that in your mind. So I think that's where we're going to kind of wrap up for this first section. So there are options for more coverage. We'll pick up right here on our next video for this Medicare 101 series. So come back, and again, while you're here, please like and subscribe. We definitely appreciate it. Visit our website and give us a call if you have questions. Have a great day.